times. Today we are going to learn about the immunity. Immunity is very interesting topic because we are able to give some relief to in the spiritual, or I can say Douglas way. I was talking about how can we uh, you know raise the immunity, increase the immunity, or you can say susceptibility to things. And one interesting, Dhananjay ji, if our immunity is strong, then what is the problem? If our immunity is strong, we start, you know, rejecting, or you can say attacking everything, whatever we take. You should be in a balanced way.
Yes, sir. Correct.
So in autoimmune disorder, what happens?
Body is against the system.
Body becomes susceptible to our own cell, our own product, our own like you are aware in diabetes, it is not that the insulin secretion is a problem. This is insulin resistance is a problem. We get resistance to that our own insulin and we are unable to use it, and that insulin accumulates in our body, not utilized. And what we do? Add again some more insulin from the different product, different source. Then also after some time, body gets immune to it, and they will not respond to those things. So likewise, the resistance to the insulin keeps on adding. That is the thing. So and even I was telling that our homeopathy and Vibrionics works on this system only. As when we think about any lemon, and we explain the process of squeezing the lemon and taking into the water, and adding this thing, when we keep explaining about the lemon, that time what happens? Our mouth becomes saliva comes increases. So what does it mean? Because our brain remembers the taste and what it has to do after the taste of lemon. When we get a lemon, how it should react, it already programmed. So likewise, once we start telling about the lemon, it will start preparing itself for accepting those lemon. So like that, it will produce the saliva, or you can say to accept that lemon. So likewise, thoughts even produces the physical reaction in our body. There are so many theories, there are so many things. That is theories called like a silva mind control, or so many. I think you all are aware of it. You just know, you are so many things we are doing it with unaware about what we are doing. So when we become aware of it, then most of the habits and other things they go away. So like that. So now we have seen at today's at this immunity topic. Immunity, one gets allergy comes under the topic of immunity, because our immune system becomes very strong and start reacting with the which it not supposed to. It's supposed to accept as a friend. It start fighting. It's very interesting. So in our, what are the products with us? How can we control the immunity? Mixture number 86, I think so, plus Soham immunity. So fantastic. Only that those are two with we will be able to no, balance our, I don't say that cure or anything, activate or deactivate, balance and perfect our immune system. But first, let us know, because very interesting, I tell you, because but immunity is one of my favorite topic, because it once somebody goes into the detail of it, he will understand everything, all homeopathy and other vibronics and everything. So two to three, I think so. We have patients we cured from the psoriasis. We took the scales of the psoriasis, the wound. Psoriasis, it produces the scale like thing, or you can say sometime it is oozing also. We take that with how we take with the earbuds. You take a earbud, you just wash with the earbud. After earbud, then put it into the distilled water in one bottle. Use the same bottle, another bottle for the potentizing it. And all these, whenever you are giving in the form of the nosode, you should always give in 200 potency. Okay, so we take a little bit of water, distilled water or in alcohol, little bit, mainly distilled water. Take that and dip that the earbud what we have taken, the scraping the wound, and put it there and shake it well. That similar bottle and the blank distilled water, or any can say pills you can put, so you can copy whatever the from inside in to out. So you can refer my uh, video on how to potentize the blood. It's well explained. So like that, two to three cases they have cured fantastically, because psoriasis, how difficult it was to cure. And now I'm very happy, because I was busy these 8 days in learning something new. Why I want to learn something new? Because people ask me, you are teaching so many people, and you are already old enough not to learn, but still you are learning. Because I have seen that it is working like magic, where we are taking more time, like 3 months, 4 months, or taking more time. There we can adapt this new technique, and fantastic. I know, because I wanted to bring that technology into the drugless therapy. It is possible, and I'm going to explain you the HARA diagnosis and the treatment in one of the lessons or within this course. Okay, so we will all be prepared for that. Okay, now let us know what is this immunity. There are two types of immunity. One is active immunity and passive immunity. We will understand that, and it's very important. If you have any doubt at the end of this video, you stop me and ask me, because with this you will understand everything. All other, especially vibronics and the homeopathy and electrohomeopathy, they are all connected to these type of immunity only, because they are making immunity strong, or you can say it is balanced. You can say it have to accept the friends and reject the enemies. And 99% our homeopathy works on this immunity only. How? We will see after this particular video. We will discuss about it. Okay. It's a very interesting topic.
Prabhakar sir, one observation can I share before we start?
Yes, 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 sir.
Uh, Sir, one thing which I've observed, because in my own condition,
Hmm.
because of my IG levels was very high,
Hmm.
when I changed my diet to
Huh.
only very high protein diet, that
Hmm.
really helped me in recovering, sir. Actually, when I was on a fiber diet, like let's say green leafy vegetables or cabbage and all of this, I always had a problem. My
Okay.
IQ was not coming up. Then when I researched as why does this trigger, especially green leafy vegetables have oxalates.
Okay.
Oxalates trigger your immune system, and especially in my case where my immune was compromised.
Okay.
Although green leafy vegetables is good for health, but because of the oxalates that we have in green leafy vegetables or anything green has oxalates. So they have a trigger on your on the white blood cells. So when I stopped it, I
Hmm.
was able to recover much faster.
That's great. Great observation. See, we could have done one more thing. There's a one more technology with us. Whatever you are allergy with,
Hmm.
take the same thing and potentize to 200 and you take it. So what
Okay,
will happen is you will get the resistance to those things.
okay,
And
okay.
Suvarna madam has worked on the like celiac disease cases. What is
Hmm.
celiac disease? They are very, you can say, reacting to the gluten,
Wheat.
wheat. Then the wheat, there is a substance called gluten.
Gluten.
So nowadays, in all Punjab, you will find so many things gluten free biscuit, gluten free things, like that. So many children are immune to. I mean, they are having allergic to the wheat and in turn the gluten. So in that one, we have used the wheat grass they used to get a wheat grass powder now at that time, now also available, but that used to increase our immunity. We made a remedy from wheat grass only.
Okay.
We made a wheat from the remedy from the wheat grass to 200 potency and we used on the children, those who are
Hmm.
suffering from the gluten problem, and
Hmm.
many things, many things change. They become healthy, their weight increase. So, and the all thing is one bad part of was we were unable to assess the condition of the children. Why? Because doing the endoscopy is a very painful job, and that too for children. You have a child, you can understand.
Yes, sir.
Making that to go the put inside the this one through the nose they put, it is
Hmm.
utterly impossible. For checking they do it because they know they have to give the report. So what
Hmm.
all spoiled in the stomach and esophagus and everything, they use it. Then after that, when they become all right, my child is okay, I don't need to test now, they say like that. So for that reason, we were unable to have the lot of evidence that our medicine has worked. But the lot of improvement was there. Huge numbers of patients were there on the in the Punjab about the same celiac disease. Okay, I why I told you anything allergic to it you can potentize and use.
Okay,
And
sir. Yeah.
so likewise, it is, and our machines are very successful in doing that.
Hmm.
Very successful. Pakka. I don't know. Really, they all, I can only exclamate like that. Oh, that is the God's grace. Huh? Okay, now we'll see a very important video, that is active and passive immunity.
This
Before that, Dhananjay ji, did I tell you last time about the ejection factor?
No, sir.
Yes, that's what. Because I remember I didn't tell about that because that it generally makes scares everyone except doctor. Every person it scares because we'll see. We'll take that because what is the passing mark in generally we want to score the good this one. How much you score in the college? We all did very less, but in the scoring, at least 80% you should score, right? Huh? होना चाहिए ना. Dhananjay ji, at least we should score 80%,
Sir,
right?
I'm 36 candidate, sir. I'm not 80% candidate.
36 is a passing.
Yes, sir.
Okay. But nowadays, if someone child comes and tells you that I scored 80%, no one will be happy nowadays, because our time, we scored very good marks, like passed in second class. So that was a great thing for us.
Yeah.
So one of our friend with us, my same name, we had only one number difference. So likewise, those days are gone now. Now we want the more and more and perfect, and the child will be very sensitive if they get the less mark. So for that reason now I will be no when we are talking about ejection factor. What is ejection factor? How fast your heart is pumping, means how strength of the heart is measured in terms of ejection factor. Every time when when you have seen last time the animation of the heart pumping, when it is pumping, how much portion, how much is the blood coming inside the heart, and how much we will be able to the transport it. That is called as the ejection factor. Now we will see that ejection factor. And what is a normal ejection factor? Is 60%. That's what I told you. If someone comes to you that saying that my ejection factor, when how we will come to know that ejection factor? With the echocardiograph. When they are doing echocardiograph, that time we will come to know what is the ejection factor. If someone comes with you with the ejection factors, sadly saying, because they always say our child should score more than 80-90%, but they have only 55% of the ejection factor, they will be very sad. That time what you have to do? You have to say your ejection factor is normal. You say that this is not the it is not the examination. This is not examination to score 100 out of 100. Here is a heart. Heart, if it scores the uh, 55 or 60 is a normal rate. Low means it can even go less than 35 also. So then you are very correct. When this, if it goes less than 35, that means it is danger. Okay, let us see what he tells about it. बिकॉज एविडेंस चाहिए भैया, ये प्रभाकर तो बोल रहा है, लेकिन क्या प्रूफ है? व्हाट इज द प्रूफ? ओके, लेट अस सी इजेक्शन फैक्टर. यस.
हेलो एवरीवन, मैं डॉक्टर नगेंद्र तालोर। आज के वीडियो में डिस्कस करेंगे इजेक्शन फ्रैक्शन क्या होता है, इजेक्शन फ्रैक्शन की नॉर्मल वैल्यू क्या होती है, और इजेक्शन फ्रैक्शन यदि बहुत कम होने लग जाता है तो पर्सन को क्या क्या सिम्टम्स आ सकते हैं, और इजेक्शन फ्रैक्शन लो होने के क्या क्या कारण होते हैं, और कैसे इसका ट्रीटमेंट या मैनेजमेंट कर सकते हैं। इजेक्शन फ्रैक्शन होता क्या है? हार्ट के जो लोअर चेम्बर्स रहते हैं उनको वेंट्रिकल बोलते हैं, और जब वेंट्रिकल कॉन्ट्रैक्ट करते हैं यानी पंपिंग करते हैं तो वेंट्रिकल में जितना ब्लड रहता है उस ब्लड में से कितना अमाउंट, कितना फ्रैक्शन वो एक बार कॉन्ट्रैक्ट करने में इजेक्ट कर देते हैं या पंप आउट कर देते हैं, उसी को बोलते हैं इजेक्शन फ्रैक्शन। सपोज किसी पर्सन के वेंट्रिकल में 100 ml ब्लड आता है और जैसे ही वो पंपिंग करता है उसमें से 70 ml इजेक्ट कर देता है, तो उसका इजेक्शन फ्रैक्शन होता है 70%। इजेक्शन फ्रैक्शन को परसेंटेज में मेजर करते हैं। और दूसरा पर्सन है जिसके वेंट्रिकल में भी 100 ml ब्लड है, लेकिन वो वेंट्रिकल 30 ml इजेक्ट कर देता है, तो उसका इजेक्शन फ्रैक्शन हो गया 30%। यहाँ पे इजेक्शन फ्रैक्शन को लेके कई लोगों को कन्फ्यूज़न रहता है। जैसे ही इको करके पेशेंट्स को बताते हैं कि आपका हार्ट का जो पंपिंग पावर है वो 60% है या 70% है, तो कुछ लोग रहते हैं वो टेंशन में आ जाते हैं, घबरा जाते हैं। वो बोलते हैं कि सर ये तो 100% होना चाहिए था, जबकि 60% ही है, 70% ही है, तो ऐसा क्यों हो गया? तो इसका आंसर ये है कि इजेक्शन फ्रैक्शन कभी भी 100% नहीं होता है। तो जो भी एलवी में या लेफ्ट वेंट्रिकल में ब्लड रहता है, वो मैक्सिमम 70% 80% तक इजेक्ट कर सकता है। टोटल 100 का 100 ml इजेक्ट नहीं कर पाता है। इसलिए इसमें घबराने जैसा कुछ नहीं है। यदि आपका इजेक्शन फ्रैक्शन 50 से 70 के बीच में आता है तो वो नॉर्मल ही माना जाता है। इजेक्शन फ्रैक्शन को LVEF भी बोलते हैं, लेफ्ट वेंट्रिकल इजेक्शन फ्रैक्शन, और शॉर्ट में EF भी बोल देते हैं, इजेक्शन फ्रैक्शन। जबकि RVEF, राइट वेंट्रिकल इजेक्शन फ्रैक्शन, के बारे में आपने बहुत कम सुना होगा। ऐसा क्यों है? क्योंकि जो राइट वेंट्रिकल है वो ब्लड पंप करती है पल्मोनरी सर्कुलेशन में, जहाँ पे ब्लड जाके ऑक्सीजनेटेड होता है, उसको ब्लड में से CO2 वॉश आउट होती है, ऑक्सीजन उसमें ऐड की जाती है, यानी ब्लड को प्योर किया जाता है। क्योंकि जो लेफ्ट वेंट्रिकल है वो ब्लड पंप आउट करती है सिस्टेमिक सर्कुलेशन में, जिसके थ्रू पूरी बॉडी में ब्लड जाता है, पूरी बॉडी में ऑक्सीजन जाती है, न्यूट्रिशन जाता है। तो लेफ्ट वेंट्रिकल हार्ट का है, उसको मेन वेंट्रिकल बोलते हैं, मेन जो पंपिंग चेम्बर है। इसीलिए लेफ्ट वेंट्रिकल इजेक्शन फ्रैक्शन के बारे में बात होती है हमेशा। RVEF के बारे में कुछ केसेज में डिस्कस करते हैं। नॉर्मल इजेक्शन फ्रैक्शन कितना होता है? नॉर्मल इजेक्शन फ्रैक्शन रहता है 50 to 70%, या इसके मिड रेंज मान लेते हैं 60%। यदि इजेक्शन फ्रैक्शन 41 से 49% है, मिड रेंज 45% है, तो उसको बोलते हैं माइल्ड एलवी डिस्फंक्शन। यदि इजेक्शन फ्रैक्शन 31 से लेके 39% है, मिड रेंज 35% है, तो उसको बोलते हैं मॉडरेट एलवी डिस्फंक्शन। यदि इजेक्शन फ्रैक्शन लेस देन 30 है तो उसको बोलते हैं सीवियर एलवी डिस्फंक्शन। और यदि इजेक्शन फ्रैक्शन लेस देन 20 है तो वेरी सीवियर एलवी डिस्फंक्शन। अब ये नंबर्स हैं, इन नंबर का क्या इंपॉर्टेंस है? क्योंकि सब लोगों को पता नहीं रहता कि किसी को बताया कि आपका EF 30 है, किसी का 70 है, तो लोगों को उनसे नंबर से क्या आइडिया मिलता है, उसके बारे में जानते हैं। तो यदि किसी का इजेक्शन फ्रैक्शन 50 से बिलो जाता है तो पेशेंट को फिर सिम्टम्स चालू हो जाते हैं। तो 41 से 50 के बीच में है तो पेशेंट्स को माइल्ड सिम्टम रहेंगे, या सिम्टम कई बार नहीं भी आते हैं। लेकिन जब वो हैवी एक्सर्शन करता है, कोई बाहरी काम करेगा, तो उसको ज़रूर सिम्टम आएंगे। लेकिन यदि पेशेंट का EF मॉडरेट टू सीवियर डिस्फंक्शन है तो पेशेंट्स को सिम्टम्स चालू हो जाते हैं और वो कंटिन्यू सिम्टम रहते हैं। लो EF के कारण क्या क्या सिम्टम्स आ सकते हैं? यदि इजेक्शन फ्रैक्शन कम है तो कई तरह के सिम्टम आते हैं। सबसे पहले एक्सर्शन इंटॉलरेंस, यानी वो एक्सरसाइज या कोई हैवी वर्क नहीं कर पाएगा। दूसरा रहता है फैटिक और वीकनेस, यानी पेशेंट पूरे दिन उसको थकान जैसा फील रहेगा और एकदम आलस सा रहेगा। मेंटल कन्फ्यूजन, पर्सन को सांस लेने में दिक्कत रहेगी, ब्रीथिंग प्रॉब्लम रहेगी। और उसका जो एब्डोमन है उसमें ब्लोटिंग रहेगा, एब्डोमल डिस्टेंशन रहेगा, राइट साइड में टेंडरनेस भी रहेगा, पीडल इडीमा रहेगा। और आप हाथ से अंगुली से दबा के भी फील कर सकते हैं, वहाँ पे देख सकते हैं फ्लूइड कलेक्शन हो जाता है वहाँ पे। पेशेंट की जो भूख है वो कम हो जाती है, एपेटाइट कम हो जाती है। कई बार पेशेंट को पाल्पिटेशन भी रहता है, उसकी हार्ट बीट उसको फील होती रहती है। तो इस तरह के कुछ सिम्टम आते हैं। नेक वेन डिस्टेंडेड हो जाती है, यानी मोटी मोटी नेक वेन दिखने लग जाती हैं जब बहुत ज़्यादा इजेक्शन फ्रैक्शन कम हो जाता है। तो ये सारे सिम्टम क्यों आते हैं, इनके पीछे क्या कारण है? तो दो रीजन है जिसके कारण ये सिम्टम आते हैं। पहला अपन डिस्कस करते हैं कि जैसे ही एलवी धीरे धीरे उसका इजेक्शन फ्रैक्शन कम होने लगता है तो एलवी अफेक्टिवली पंपिंग नहीं कर पाती है और वो पंप करके ब्लड को इजेक्ट नहीं कर पाती है। तो ऐसी कंडीशन में क्या रहेगा कि एलवी में जैसे 100 ml ब्लड आ रहा है और वो पंप कर पाती है 30 ml, तो 70 ml एलवी में रह जाता है। नेक्स्ट टाइम फिर 100 ml आता है, 30 ml वो पंप कर पाती है, तो फिर 70 ml उसमें रह जाता है। इस तरह एलवी में क्या ब्लड कलेक्ट होता जाता है, फॉरवर्ड डायरेक्शन में ब्लड जा नहीं पाता है, तो वो सारा ब्लड वापस बैकवर्ड डायरेक्शन में जाता है। तो एलवी से एलए में जाता है, एलए से पल्मोनरी वेन कनेक्टेड रहती हैं, पल्मोनरी वेन में जाता है वो, और पल्मोनरी वेन कैपिलरीज और लंग्स से कनेक्टेड रहती हैं। तो सारा जो प्रेशर है वो बैकवर्ड शिफ्ट हो जाता है और लंग में कंजेशन हो जाता है, एलियोलाई में फ्लूइड कलेक्शन हो जाता है। तो एलयूआई में पूरा ऑक्सीजन और गैस का एक्सचेंज नहीं हो पाता है, तो पेशेंट को सांस लेने में दिक्कत होने लग जाती है, उसको डिस्निया होने लग जाता है। और धीरे धीरे जैसे जैसे और ईएफ कम होता जाता है, ये लंग प्रेशर है वो भी फिर बैकवर्ड शिफ्ट होता जाता है, जैसे राइट वेंट्रिकल और राइट एट्रियम में शिफ्ट हो जाता है। वो फिर वहाँ से जैसे सुपीरियर वेना केवा आती है और इन्फीरियर वेना केवा है, उधर भी प्रेशर बढ़ जाता है। यदि सुपीरियर वेना केवा का प्रेशर बढ़ जाएगा तो यहाँ गर्दन के पास में आपको मोटी नेक वेन है वो काफ़ी मोटी और डायलेटेड दिखाई देंगी। यदि आईवीसी में प्रेशर बढ़ जाएगा, आपका इंटेस्टाइन है वो भी कंजेस्टेड हो जाएगी, इडिमेटस हो जाएगी और आपके पूरी पेडल इडिमा हो जाएगी। इस कारण से आपको सांस लेने में दिक्कत रहेगी, आपका एब्डोमिनल डिस्टेंशन हो जाएगा, आपकी लॉस ऑफ एपेटाइट हो जाएगी, क्योंकि इंटेस्टाइनल है जो कंजेस्टेड है, भूख नहीं लगेगी आपको। दूसरा ये है कि जब सारा ब्लड और फोर्स बैकवर्ड शिफ्ट हो गया तो फॉरवर्ड डायरेक्शन में ब्लड बहुत कम जाता है, जिसके कारण लो कार्डियक आउटपुट के साइन आने लग जाते हैं, सिम्टम आने लग जाते हैं। तो लो कार्डियक आउटपुट के सिम्टम रहते हैं जिसमें एक्जिशनल इंटॉलरेंस है, फैटिग है, टायर्डनेस है, कन्फ्यूजन है। तो ये सारे सिम्टम आते हैं जो लो कार्डियक आउटपुट के कारण होते हैं। इजेक्शन फ्रैक्शन कम होने के क्या क्या कॉज रहते हैं उसके बारे में डिस्कस करते हैं। सबसे पहला कारण है कार्डियोमायोपैथी, यानी कार्डियोमायोपैथी का मतलब है कार्डियो मीन्स हार्ट और मायोपैथी मानी मसल्स की डिजीज। यदि हार्ट की जो मसल्स हैं वो बहुत ज़्यादा थिन हो जाएंगी या थिक हो जाएंगी और डायलेट हो जाएंगी तो प्रॉपर पंपिंग नहीं कर पाती हैं, तो उस कंडीशन में ईएफ कम हो जाता है। दूसरी कंडीशन होती है कोरोनरी आर्टरी डिजीज, यानी हार्ट को जो ब्लड सप्लाई करती है उन आर्टरीज को कोरोनरी आर्टरी बोलते हैं। और यदि एक या एक से ज़्यादा दो आर्टरीज में ब्लॉक हो जाते हैं, हार्ट को प्रॉपर ब्लड सप्लाई नहीं होती, तो हार्ट का इजेक्शन फ्रैक्शन या पंपिंग पावर कम हो जाता है। तीसरा कारण रहता है एक्यूट हार्ट अटैक या मायोकार्डियल इन्फार्क्शन। जैसे ही हार्ट अटैक होएगा, सडन हार्ट की ब्लड सप्लाई रुक जाएगी और उस हार्ट का वो वाला पार्ट प्रॉपर वर्क नहीं कर पाएगा, तो इजेक्शन फ्रैक्शन कम हो जाता है। नेक्स्ट कॉज होता है कंजेनाइटल और एक्वायर्ड वाल्वुलर लीजन्स। यदि हार्ट के जो वाल हैं उनमें या तो प्रॉपर क्लोज नहीं हो पाते या प्रॉपर ओपन नहीं हो पाते, दोनों ही कंडीशन में धीरे धीरे आगे चल के इजेक्शन फ्रैक्शन कम हो जाता है। नेक्स्ट कंडीशन है हार्ट फेल्योर। हार्ट फेल्योर का मतलब हुआ कि हार्ट प्रॉपर पंपिंग नहीं कर पाता है, उसकी जो पंपिंग करने की कैपेसिटी है वो कम हो जाती है, तो उसमें भी इजेक्शन फ्रैक्शन कम हो जाएगा। इजेक्शन फ्रैक्शन की वैल्यू के आधार पर हार्ट फेल्यूर को दो पार्ट में डिवाइड किया गया है। एक रहता है हार्ट फेल्यूर विथ रिड्यूज इजेक्शन फ्रैक्शन, यानी उसमें पेशेंट का इजेक्शन फ्रैक्शन रिड्यूज हो जाता है, यानी लेस देन 40 हो जाएगा। यदि लेस देन 40% इजेक्शन फ्रैक्शन है तो उस कंडीशन को बोलते हैं हार्ट फेल्यूर विथ रिड्यूज इजेक्शन फ्रैक्शन। उसमें होता क्या है, हार्ट की जो मसल्स रहती हैं वो थिन हो जाती हैं, डायलेट होने लग जाती हैं, तो हार्ट की जो पंपिंग करने की कैपेसिटी है वो रिड्यूज हो जाती है, इसलिए उसको बोलते हैं हार्ट फेल्योर विथ रिड्यूज इजेक्शन फ्रैक्शन। दूसरी कंडीशन रहती है जिसमें हार्ट का इजेक्शन फ्रैक्शन प्रिजर्व्ड रहता है, यानी नॉर्मल रहता है, मोर देन 50% रहेगा, लेकिन फिर भी पेशेंट्स को सिम्टम आते हैं हार्ट फेल्योर के। क्यों? क्योंकि उस कंडीशन में आपका हार्ट बहुत ज़्यादा थिक होता जाएगा, थिक होता जाएगा, मोटा होएगा, तो जो एलवी कैविटी है वो बहुत छोटी रहेगी, तो उसमें जो कार्डियक आउटपुट है वो आपका कम हो जाएगा, तो उस कंडीशन में भी पेशेंट्स को सिम्टम आएंगे। नेक्स्ट ये है कि इजेक्शन फ्रैक्शन को मेजर कैसे करते हैं। तो इजेक्शन फ्रैक्शन मेजर करने के लिए बहुत सारी मेथड्स हैं, लेकिन सबसे अच्छा और बेस्ट मेथड है 2D इकोकार्डियोग्राफी। इकोकार्डियोग्राफी बहुत ही सिंपल टेस्ट है, हर ओपीडी में ये मिल जाती है इजीली, और इसमें कोई रेडिएशन एक्सपोजर भी नहीं होता, नॉन इन्वेजिव है, पेशेंट को पेन भी नहीं होता है। यहाँ पे कुछ इकोकार्डियोग्राफिक इमेज हैं, जिसमें फर्स्ट इमेज है उसमें आप देख सकते हैं जो राउंड सर्किल दिख रहा है वो आपका लेफ्ट वेंट्रिकल है, तो इसमें लेफ्ट वेंट्रिकल यूनिफॉर्मली कॉन्टेक्ट कर रहा है, यानी इसका इजेक्शन फ्रैक्शन नॉर्मल है। दूसरा इमेज है जिसमें आप देख सकते हैं वेंट्रिकल का जैसे ऊपर का पार्ट है वो तो अच्छे से कांटेक्ट कर रहा है, लेकिन नीचे का पार्ट बहुत स्लो कांटेक्ट कर रहा है, तो उसको बोलते हैं रीजनल वाल मोशन एबनॉर्मलिटी। मोस्टली वो हार्ट अटैक में होता है। तो इसमें आधा पार्ट अच्छे से काम कर रहा है, आधा पार्ट काम नहीं कर रहा, लेकिन इजेक्शन फ्रैक्शन इसका भी कम हो जाता है। तीसरी इमेज है जिसमें आप देख सकते हैं नीचे का पार्ट है वो प्रॉपर काम नहीं कर रहा है, जबकि ऊपर का पार्ट अच्छे से काम कर रहा है। चौथी इमेज है जिसमें देख सकते हैं आप यूनिफॉर्मली, यानी पूरी एलवी है वो प्रॉपर वर्क नहीं कर रही है, प्रॉपर कांटेक्ट नहीं कर पा रही है, बहुत स्लो कांटेक्ट हो रहा है, जिसको बोलते हैं ग्लोबल हाइपोकाइनेजिया, यानी पूरी वेंट्रिकली काम नहीं कर रही है। ये मोस्टली हार्ट फेल्यूर या डायलेटेड कार्डियोमायोपैथी में देखने को मिलता है। इसके साथ साथ इको में ये भी पता लगा सकते हैं कि जो इजेक्शन फ्रैक्शन कम हुआ है उसका क्या कारण है। हार्ट अटैक के कारण कम हुआ है, हार्ट फेल्योर के कारण कम हुआ है, या कोई वाल्वल पैथोलॉजी के कारण कम हुआ है, या कोई हार्ट की मसल्स की दिक्कत है जैसे डीसीएमपी एंड डायलेटेड कार्डियोमायोपैथी हुआ है। इसलिए इको बहुत अच्छा टेस्ट है और इसमें कोई डाई भी इंजेक्ट नहीं करना पड़ता। इसलिए जो CKD पेशेंट या जिसका क्रेटिनिन ज़्यादा रहता है उस लोगों में भी इजीली कर सकते हैं। दूसरे टेस्ट हैं जैसे MRI है, CT स्कैन है, न्यूक्लियर स्कैन है और कार्डियक कैथेटराइजेशन है। इन चारों कंडीशन में पेशेंट्स में डाई भी दी जाती है, रेडिएशन एक्सपोजर भी होता है, और ये जो सीवियर हार्ट फेल्यूर वाले जिनका इजेक्शन फ्रैक्शन बहुत कम है या किडनी भी अफेक्टेड है उन लोगों में ये रिस्की रहते हैं, तो इसलिए इन लोगों में ये सेफ नहीं है।
Good. So you have learned many things about this. And what are the remedy with us?
Heart tonic, sir.
Yes, heart balance, palpitation, heart balance, OM7. I always say heart organ medicine. In that one, everything is there. And circulation 3x, circulation balance. So these are the remedies we can attend with this based on the symptoms. Okay, then now next today's topic, let us go to because I remember I didn't tell last time for that reason, because very important, because the patient will be very upset when they hear that they have only 65% ejection factor. Then you must say that 50 to 60 is normal range and give them the himmat de do unko. That's it. Okay. Today again, passive and active immunity. Very interesting. Please listen carefully and many times also.
This one here is a very bad bacteria. This bacteria dared to enter my body, but my body is gifted with a very strong immune system. We humans are gifted with a very strong immune system. And what our immune system does? The first thing our immune system does is that it recognizes the foreign invader, in this case a bacteria, and then produces weapons specific for that foreign invader. So it will produce you can say customized special weapon against this bacteria, which we call antibodies. So these antibodies are made specially for this bacteria. So now these antibodies will go and bind to this bacteria and then call more immune cells and finally kill this bacteria. So this bacteria will be eventually killed. But that is not the end of the story. Our immune system future-proofs us from this bacteria. It prepares another special type of cell called the memory cell. This is very important. This memory cell now will stay in our body and will fight this bacteria if it dares to enter our body again. We will talk about this memory cell in a minute, but before that, let me tell you that our immune system initially had no idea what this bacteria was. But once this bacteria got inside our body, our immune system tried to recognize or understand parts of this bacteria, and it produced antibodies against it. So we are not born, or our immune system are not born with the knowledge of this foreign invader, this bacteria. But during our lifetime, as our immune system comes in contact with the new foreign invaders like bacteria, viruses, it adapts itself to produce immunity towards those foreign invaders. And therefore, this type of immunity is called adaptive immunity. Now, I want you to imagine a situation in which your friend Ram, as he was going back to home from school, was bitten by a snake. And now you just saw that. What will you do? You will probably rush him to the hospital where the doctor will give him some anti-venom shots. Now my question is, just like the bacteria, this venom of the snake, let me write it again, the snake venom is also a foreign substance for the body. And just like our immune system worked against the bacteria, our immune system should also work against the snake venom, right? So why do people panic during a snake bite? And why do we rush to hospital and we are given anti-venom shots? Well, the answer to this lies in the time that our immune system requires to function. So here is a graph. The x-axis gives the time and the y-axis gives the antibody amount in your body at any point in time. Now, as you can see, this is the first exposure. Let's talk about bacteria. So this bacteria entered the body, and this is the first day of exposure. And as you can see, our immune system took some time to react to this foreign particle. So it took around 4 to 7 days just for our immune system to recognize these foreign particles and produce antibodies against this foreign particle. But if we wait that long, in case of a snake bite, a person will die. And the reason is snake venom are very potent. It works very fast. Unlike bacteria, they also need some time to create havoc inside our body. And that time is utilized by our immune system to create weapon against the bacteria. But in this case, the snake venom is very potent. It won't give our immune system any time to prepare any weapon against them. And therefore, we need to take anti-venom shots. Now, do you know what these anti-venom shots contain? These anti-venom shots are nothing but antibodies against that snake venom. Now, where do doctors get these antibodies against snake venom? Because we saw our immune system produces specific antibodies against a specific foreign invader, right? So where did the doctor get specific antibody against snake venom? They get it by injecting the snake venom into horse or some other mammal. Generally, horses are used because it is seen that horses could quite resist the effect of snake bite. So once the snake bites a horse, the immune system in the horse body produces antibody. Those antibodies are extracted and stored as anti-venom shots. Interesting, right? Now, in case of the snake bite, as we just saw, we got the antibodies from outside. So the kind of immunity that we received by the introduction of antibodies from another person or animal is called passive immunity. Because here, we didn't produce our own antibodies. So you can already guess what this kind of immunity is called. The immunity in which our body produces our own antibody and memory cells. I'm sure you have probably guessed it by now. This is called active immunity. So let me write down active immunity. Now, apart from the difference of producing our own antibody in case of active immunity and introducing external antibody in case of passive immunity, what other differences can you spot between these two types of adaptive immunity? Just pause the video for a second and think about it. Alright, so the first difference that I can spot is this memory cell. In active immunity, we get memory cells. Our body produces memory cells, but there is no question of memory cells in case of passive immunity because here we have introduced antibodies from outside. So there is no question of memory cells. So let me write down that in case of active immunity, memory cells are produced, but in case of passive immunity, no memory cells are produced. Okay, now these memory cells are important because if that foreign invader gets inside the body again, our body has a weapon to fight against it. But in case of passive immunity, let's say your friend Ram was attacked by snake again. He will have to take the antivenom shots again, right? So in case of passive immunity, there is no memory. So there is no weapon left that could recognize the foreign invader that have attacked the body previously. So this is the very first difference, having memory cells and not having memory cells. And the next difference lies in the time of action. So let me bring in the graph again. So let's first discuss about active immunity. This is the first day when the foreign invader entered the body, and this is the number of days our immune cells or our immune system took to act against that foreign invader. So it took around 4 to 7 days. But in case of passive immunity, the day the venom entered, the same day the antivenom shots were given that had antibody readily made that can go and bind to antivenom and destroy those antivenoms, right? So which of the two is faster? Passive immunity, right? Because as soon as the antivenom shots are given, it will go and destroy the snake venom. But in case of active immunity, our immune cell took quite some time to act against the foreign invader. So active immunity is comparatively a slow process, whereas passive immunity is comparatively a fast process. Now, I like to remember active immunity as home-cooked food and passive immunity as ordering food from outside. So you must be thinking, why is she making this weird comparison? This is just a trick to remember, okay? So passive immunity means ordering food from outside. So how do I relate? When you order food, you get the order really very fast. But if you cook food at home, you have to give a lot of time to cooking, right? So when you cook food, it is slow. It takes a lot of time to cook food. But if you order food, it's very fast. The delivery happens within minutes. And again, if you order food, you will not know how that food is cooked. So the next time you want to have the same food, you will have no option but to order again. So there is no memory of how that food is cooked, because there is no question of memory here, right? Because the food is not cooked by you. But in case of active immunity, as you have cooked your own food, you will know how that food is cooked. So the next time you want to have the same food, you can cook it yourself. Okay, so active immunity, we will compare it to home cooked food, and passive immunity is ordering food from outside. All right, I'll give you an example of adaptive immunity, and how about you guess whether it is an active adaptive immunity or passive adaptive immunity? All right, so the example is of vaccination. What do you think vaccination is? Because vaccination provides immunity, right? So what do you think? Is it an active immunity or passive immunity?
Active immunity.
Let's find out. So in order to find out, we need to know what we inject actually in case of vaccination. So in a vaccine, we actually have non-infectious part of a harmful pathogen. So if this vaccine is against a virus X, then this vaccine will contain either parts of this virus X, or this virus is dead and the entire dead virus is used in it, or this virus is somehow made non-virulent. That means made non-infectious. And those viruses which are non-harmful are administered into the human body. Now, why do we do that? We do that to introduce our immune cells to those foreign harmful particles. Now, once our immune cell comes in contact with the virus X, whether parts of the virus X or whether dead virus X or whether non-infectious virus X, our immune cell will immediately recognize it to be something foreign and produce antibodies and memory cells against it. So this memory cell is very important, and this is the reason why vaccines are administered into human body, so that later when the actual pathogen, when the harmful live pathogen, live virus gets inside the body, there will be memory cells already sitting there in our body that will immediately recognize and fight that pathogen. Now, what do you think? Is vaccination an active or a passive adaptive immunity? Well, since vaccination made our body produce its own antibody and own memory cell, therefore it is an active adaptive immunity. Now, even though these two are the examples of active immunity, there is a slight difference in both the examples. In the first one, the bacteria entered the body all by itself. It happened naturally. So, this type of active adaptive immunity is called natural. So, this is natural. But here, in case of vaccination, we had to administer it ourselves, right? There was human intervention. So this one is called artificial. So active immunity can be of two types. Natural, this type of immunity takes place in every person and we do not need to do anything about it. It happens naturally and it is true for all living organisms or human beings. An artificial active immunity is something in which human intervention is required. But since both these immunities are active immunities, we produce antibodies and memory cells. So even in natural and artificial, if we see, both antibodies and memory cells are produced. Now, just like active immunity, passive immunity also has natural and artificial immunity. So what do you think this is? The antivenom shot? What do you think it is? Is it an natural or artificial passive immunity? What do you think it is? Well, this is an artificial passive immunity because here human intervention is required and people don't get it naturally. It is not true for everyone. So this is artificial passive immunity. Now, how about you think of a natural passive immunity? The definition of natural would be that it is true for every human being. A person do not need to put extra effort in order to get that kind of immunity. So think of an example of natural passive immunity. Now, this natural passive immunity is the one that you, me, and every one of us have got as a newborn child. We get IgA, which is immunoglobulin A, or we can call it an antibody from our mother through the breast milk. And that provides immunity to the newborn child. So this type of immunity is passed on from a mother to a child. We do not have to put in extra effort in order to get this immunity. So this was all about adaptive immunity. Now you can try and find out more examples and check whether it comes under natural or artificial active and passive immunity. This one here.
Excellent. I think so. Everybody is understood. Is there any doubt? Because this is
Sir, I have
very, very important. Yes, sir. Yes.
Sir, why is horse actually chosen as the host for these kind of
Yeah,
tests?
come again. I am not able to listen.
Why is a horse selected here, sir? Because that's
Because
near.
that has got the immune to snake.
Oh, okay.
Even if a horse is bitten by a snake, it
Okay.
doesn't die. It
Oh, okay.
produces, like, if a mosquito is biting us, we will get the immunity by that poison of this mosquito. Okay, yeah, even dengue sometime when a dengue mosquito bites us, it will take some time, it will attack our the platelet, and we will go down and come up like that in natural way. Like that, even in horse, when a snake is biting, that it produces the immunity. And you can there when the antibodies of the horse, they are separating and storing in the as a remedy, as an injection.
Okay, sir. Okay.
There is a major two things here. You are giving the antibody or antibodies, or this is a, yes. This is a natural antibody body is produced here naturally. Here it is directly feeding from the horse. And one example also is given. There is a artificial passive immunity. That is, we are using from the horse the antibodies, and that is called as a artificial passive immunity. So here natural passive immunity. How that natural passive immunity? That is through the breast milk, because it is a God's creation. Baby should not get attacked by any invader. For that, directly, because very interesting thing. Unless until you get the different type of bacteria and virus, your body don't get immunity. You won't get natural immunity. You will not get, because there is a lot of research. You know how many people killed in the China and America with the corona. Very less people died in the India. You know, as comparatively, why it is so? Why it is so? The earlier also, like a SARS and so many infectious disease came and gone. It did not, you know, it did not totally, vanish our complete humanity. Why? Because they have studied Indians have a natural immunity due to exposure to the unhygienic condition. You have understood? We are exposed to unhygienic condition. हम लोग बोलते हैं ना, अरे बेटे को नीचे मत बैठना, एंड वो लेकिन कितना भी करो, दे विल पुट जमीन में हाथ लगाएंगे और दे विल पुट इनटू द माउथ. कितना वॉच करेगा? You will not be able to, because with that what happens? They get a immunity. जितना हम उसको सेफ करके पालते हैं, we take care, that much immunity will be low. Our laborers children will be playing somewhere in the sand, और अगर जो construction worker जो रहते हैं, they will be playing, they will be eating sometimes sand and all. They are very strong, not like our kids. The similar thing, that is the thing. So natural immunity, we need to expose to a different virus and bacteria. With that we get a immunity. And what is the advantage of this? That will be remembered by our immune system. If next time that particular person comes, they are ready to fight. So in term, what is what is the what do you call difficulty in if you give the antibiotic, then what happens? Second time if you use that antibiotic, it will not be so effective. For that reason only, first test is there, antibiotic sensitivity. So very interesting. When your blood is sensitive to so many antibiotics, which is reactive, that they will choose for you to treat. Dhananjay ji, is very interesting. If no reactive, they don't use. They test your blood with some antibiotic. If you are sensitive to antibiotic or reactive to antibiotic, then only they will give you.
Sir, but right now, if I go to any doctors, by default they give antibiotics without even testing if the antibiotic will work or not. they give this broad spectrum antibiotic, which is like either it will work, it will not work.
That
Right?
is the thing, because because many of our kids are there in UK and USA and that Australia, they never do like that. They
Yes,
don't
sir.
give any, even paracetamol also they don't give.
Yes,
They
very true.
first
Yes.
they test, and the first they have to undergo the antibiotic sensitivity test. So if the most lesser, this thing is amoxicillin.
Mm.
Amoxicillin is like a tonsils and so many things, they're starting with a amoxicillin is a very beginning stage of the disease, they give it. If they are sensitive to amoxicillin, then other things they may try. Like, in corona, what they give, azithromycin and, ciprofloxacin. Yeah, so they
Paracetamol.
will see they are, they are all derived from, I heard it's all derived from the penicillin. Penicillin. What is penicillin,
It's a bacteria. It is. It's a
Penicillin is a
fungi.
bacteria. That is a penicillin is a, what I heard, we have to confirm once again, this is the uh, mold. Mold,
It's a
not mold. It is just
it's
like
a
a
fungus.
one sort of
Yes.
fungus type thing.
It is grown on the bread, sir.
Yes,
It
it is
was.
grown on the bread. I remember it is a childhood, children, when your children, it is taught like that. It is grown on the bread. And because that is banned now. Now, nowhere you will get the penicillin injection. That is banned because it was very sensitive. But we have in our remedy, we have a remedy called penmycin. Penmycin is the combination of penicillin and streptomycin. Both are very strong antibiotic. Even today, if some, in villages, to give a quick result, they are using penicillin. After checking the penicillin sensitivity, they just prick here in the wrist and they make them to wait. If nothing happens, no reaction happens, then they give the penicillin, or otherwise it may be a fatal also. So that's what here, you have seen the why Vibrionics, or you can say homeopathy, is little delay. It makes little delay because it it reacts with your natural immune system. For reacting with your natural immune system, it takes little time. So for that reason only, and in our like a homeopathy and other thing, there are so many other remedies which are like a chicken pox preventive. Chicken pox preventive is pulsatilla. I will give you that list because today the immunity topic we are going on. From the next we class, we start that preventive. What are the preventive for the so many diseases? The pulsatilla is a preventive for the measles and chicken pox. So what happens here when pulsatilla is given here? It produces our active immunity, and whatever the antibodies whatever it is producing, it is capable of fighting actual measles and the chicken pox. I understood, no? Very, very, very interesting. The pulsatilla, that remedy, when you are taken, it is just like all disease product. All homeopathy is made up of all law of similar means it is a disease product, or you can say some allergic to our body. If when that comes, like a pulsatilla comes here, our immune system reacts with that and makes the antibody and remembers also. And this memory, when actual measles comes, that those configuration and pulsatilla configuration are same. So it remembers, oh yes, I should fight with these antibodies. So it produces these antibodies and fight against the chicken pox and the measles a virus you can call, or bacteria, or you can substances you can call. Okay, this is how it beautifully acts. And not every medicine, I believe every medicine acts like that. For that reason only, once when remedy is taken inside, it immune system reacts to it and have a natural way. It if because we are introducing the toxin substance, or you can say negative things, and so which created the problem, which will cure the problem. So like whatever it is created, we are putting it in a small amount and making our immune system, triggering the immune system and produces the antibody, and that also remembers, see what sort of antibody is produced for what sort of symptoms. There is another homeopathic terminology called genus epidemicus. Genus epidemicus is the all the symptoms, like corona. In the what was the remedy for corona in the preventive and as well as curative remedy was there? Mostly used was arsenic alba. Arsenic alba was used as a corona preventive, and the even for a cure also they used it. How they come to know? Because the set of the symptom produced by the arsenic alba and the set of symptom produced by coronavirus were exactly same, all similar to some around 80 to 90%. So they have decided it is the remedy for corona. And when arsenic alba, when it is ingested in the body or taken by a healthy person, that time it produce the antibodies, and it be remembered also a similar set of like arsenic. Coronavirus produces similar symptoms, so these antibodies assumed that it is arsenic like thing is coming, and they produces the antibody, and this fighted against the natural disease, and they were out of it. And few of things were, some symptoms were, because if it is 60% match is there, that time 30% 40% problem will be there, but it is not that severe extent, but it will be able to tackle because when the many people, those who are taken the arsenic as a preventive, many did not go the full scape of corona disease episode. Okay, now I think so. Now next thing is allergies. Yes, because allergies also is one part of the immune system only. So let us see what is allergy, what it causes, and we'll also think about thymus gland, how it is helping in the immunity. So let us see. Before that, we will take another video.
In this animation, we want to show the human immune system with images never seen before. We will learn how macrophages as well as other cells and mechanisms protect our organism from death every day. Our skin, like the bark of a tree, represents valuable protection. However, the skin is also home to countless microorganisms. Among other things, they are nourished and protected by an oily fluid called sebum. Sebum is produced by sebaceous glands. Sebum also contains antimicrobial elements that can kill microbes. If there are harmful or too many microbes on the skin, the sebum is composed in such a way that these microbes are killed. This creates a harmonious coexistence between skin cells and microbes, a kind of symbiosis. These microbes also keep one another in balance and kill pathogens that can be dangerous to our cells. The protective layer of hollow organs such as the nose, mouth and trachea is a mucous membrane. Mucous membranes possess cilia. Cilia move back and forth in a wave-like manner. This allows them to move mucus, to which foreign substances adhere, upward into the oral cavity. If mucociliary clearance is not sufficient, an attempt is made to achieve clearance of unwanted particles through coughing. This is done by inhalation followed by a sudden exhalation, so that foreign substances are removed from the lungs and trachea. The bone marrow has stem cells. It is the birthplace for many different immune cells, which we also call leukocytes. Stem cells divide to form daughter cells, asymmetric or symmetric. Symmetric cell division results in either two stem cells or two progenitor cells, as seen here. The progenitor cells divide again and again. Thus, a single stem cell becomes many immune cells or leukocytes. A common immune cell is the neutrophil. Some of the neutrophils remain in the bone marrow, while others make their way into the bloodstream. Our neutrophil belongs to the so-called innate immune system and moves through the blood vessels. During inflammatory processes, the endothelial cells of the blood vessels have special receptors. Thus, initially there is weak adhesion, then strong adhesion, and finally the granulocyte goes through the endothelium. This process is called diapedesis. The path through the connective tissue has already been made by other neutrophils. Our neutrophil only has to follow cytokines, that is, signal substances of other cells, a process called chemotaxis. There they are, bacteria, everywhere. They produce toxins and thus harm the cells of the organism. A neutrophil's job is to eat these bacteria. This eating process is called phagocytosis. In addition, some of the neutrophils produce certain cytokines that attract other granulocytes. Other cells of the innate immune system are macrophages. They arrive on the scene before neutrophils, phagocytose bacteria, and produce a signal substance, tumor necrosis factor. It suppresses the feeling of hunger, causes fever, stimulates leukocyte production. Another leukocyte type is the T cell. T cells possess receptors. What do they need them for? Macrophages are professional antigen-presenting cells. They have the ability to present antigens via certain proteins on their surface, and this initiates certain processes. Some T cells can use their receptors to recognize exactly those antigens of the macrophages for which they have been trained in the thymus. Let us take a closer look at this. T cells are also formed in the bone marrow. They then migrate via the bloodstream to the thymus. Because they mature in the thymus, they are called T for thymus cells. In the thymus, which is one of the primary lymphoid organs, T cells form antigen receptors. Afterwards, they usually migrate to secondary lymphoid organs, such as the lymph nodes and the spleen. And the lymphoid organs, naive T cells and dendritic cells meet. The dendritic cells have already had contact with a pathogen and present the antigen on the surface. They are also professional antigen-presenting cells. The T cell scans the dendritic cell for the antigen for which the T cell was trained in the thymus. If it finds the antigen, T cell activation begins and, among other things, clonal expansion occurs. The cell reproduces itself thousands of times. These cells respond to a specific pathogen or antigen. Then, some T cells start their journey and migrate to other tissues. Once there, the cytotoxic T cells scan other cells with their receptors to look for cells that have the specific antigen on their surface. If they find their antigen in a cell, they know that a pathogen, for example, is in the cell. The cytotoxic T cells begin to induce apoptosis. The cell's debris are eventually eaten by macrophages and new cells form. There are not only cytotoxic T cells, but others as well. T helper cells, memory T cells, regulatory T cells, and others. T helper cells work hand in hand with B cells. B cells possess receptors like T cells. Like T cells, B cells also originate in the bone marrow. They then search for their specific antigen in the lymphatic system or in the bloodstream. If the B cell finds its antigen with its receptors, either activation occurs immediately or the B cell moves into the lymphoid tissue where T helper cells wait. T helper cells, as we've seen before, were also trained for one specific antigen. For this reason, the B cell presents its antigen on the surface. This allows the T cell, with its receptors, to scan the B cell. If it is the antigen for which the T cell has been trained, it gives the starting signal for the division and maturation of the B cell. As with T cells, clonal expansion occurs. Thus, thousands of new B cells or plasmablasts and plasma cells are generated from a single B cell. Memory B cells are also produced, which will spring into action in the event of another subsequent infection. During acute infection, plasmablasts and plasma cells immediately begin to produce antibodies, and they release these antibodies into the bloodstream. Antibodies are also often called immunoglobulins. At the toxin, the bacterium, the antigen is in the blood, the antibody just produced by the plasma cell can bind to it. In this way, for example, a toxin can be rendered harmless and an antigen can be marked so that macrophages can recognize it more easily and phagocytize it more quickly. This process is called opsonization. All immune cells have a stem cell as their origin. It develops into progenitor cells and eventually into the immune cells just shown. Other important immune cells are natural killer cells and platelets. Platelets, also known as thrombocytes, originate in the bone marrow from megakaryocytes. Megakaryocytes have pseudopodia that extend into blood vessels of the bone marrow. It is through these pseudopodia that platelets are emitted into circulation. One megakaryocyte can produce 1,000 to 3,000 platelets. This process is called thrombopoiesis. The platelets move through the blood vessels of the body. If injury to a blood vessel occurs, hemostasis begins. The platelets adhere first to the collagen fibers of the connective tissue and eventually adhere to one another. This results in a quite fragile platelet plug, which prevents the blood from escaping. Eventually, fibrin strands form on the platelets, which ensures a stronger plug. And it will bind more platelets and red blood cells. Thus, a strong clot is formed.
Good, fantastic. So nice animation. Yes. Now, we already covered that what is the thymus is doing. Is doing the stem cells, and that stem cells is going into the thymus cell, thymus gland. From thymus gland, it is making the T cells, thymus cells, special cells. So there are many types of what it does. Generally, wherever there is a intruder, that time it produces the T cell. Okay, so that even in immunotherapy, what they do, they grow these cells, take our own cells and replicate it, and they collect and they give back to our body. Anyway, if you are interested, you can go through the immune therapy techniques. Now we will come back to the allergy.
Do you love smelling flowers? Well, I do too. But do you know, every time we smell a flower, there are high chances that the pollen in the flower might get inside our nose. So, should we be worried about it? Well, most of the time when the pollen enters, nothing actually happens. It doesn't affect our body. But in some people, like in case of my brother Ram, every time he smells a flower, he sneezes like crazy. And he also gets this watery eyes, runny nose, and redness and swelling around his nasal area. Now, since Ram's body reacts in a very different way towards a non-harmful substance like a pollen, Ram is said to have an allergy towards pollen. Now, anything that triggers an allergy is called an allergen. So this pollen is an allergen for Ram, but it is not an allergen for me because I don't get all these symptoms when I smell a flower. Now the question is, what is happening different in case of Ram? Because we are closely related, we are siblings, and we share fair amount of our DNA. So why is Ram's body reacting in a different way than mine? Let's find out. Let's begin by talking about the word allergy. Allergy comes from a Greek word which means change in reaction. Now, what reaction is it talking about? It is talking about the body's immune cells' reaction. The immune cells somehow tend to become oversensitive towards non-harmful substances. And that reaction of our immune cell towards non-harmful substances causes an allergy. So allergy is actually the weird reaction of our immune system. Our immune system somehow tends to behave in a very weird way. So to see how the immune system behaves differently, how about we check my immune system and then my brother Ram's immune system every time we inhale some pollen. Okay, so this is me. I am not allergic to pollen, and as you can see, I have inhaled some pollen. Now what will happen after that? The pollen will first encounter the hair that's present in our nasal passage. So these are the hairs, okay? And this one here is the pollen. So the pollen will try to enter our nasal passage. So the first obstruction will be the hair, and then beneath the hair will be a dense mucus layer. So these are the mucus. So some pollen will be trapped by the mucus, but let's say the pollen has passed the mucus layer as well. Then beneath the mucus layer will be the epidermal layer. So these are our epidermal cells, the outer layer. But the pollen is so stubborn that it has passed all these layers and have gone deep down under this epidermal layer. So let's say here is the pollen. But the pollen has no idea that our body has got defensive cells, which we call immune cells. And this pollen will now encounter our immune cells. Now this is where the difference is. The immune cells from here on will start acting differently in me and in case of my brother. So let's see how my immune cells behave, okay? So let us consider that somewhere here, the pollen has got inside the epidermal layer. So as soon as it enters, it will face our immune cells. So this one here is a pollen, and this is the immune cells. Now the immune cell will phagocytose the pollen, or we can say the immune cells will eat the pollen. Now after they do that, they will release some chemicals in this vacuole, and it will destroy the pollen particles. It will break down into small non-functional pieces, and that is the end of the pollen story inside my body. Simple, right? Now let's see what happens differently in case of my brother Ram. So here is Ram. He is allergic to pollen. Okay? In case of Ram, the immune cells, after eating up the pollen, displace the pollen to the other immune cells. Let me show you how. They do it with the help of a special protein called MHC class 1. Now the question is this protein not made in my body? The answer is yes, it is present in my body, my immune cells as well. In fact, it is present in all the cells of our body. But why is it displaying the parts of a pollen to other immune cells in case of Ram, but not in case of me? The answer lies in the structure of the MHC molecule. This is the MHC molecule, which has this variable region here, and this one here is the pollen. Now, this variable region is formed from a random shuffling of a piece of DNA, or we can say a gene that codes for the variable region of MHC. It randomly shuffles and forms this variable region. So it is sheer luck that the variable region of Ram somehow could attach to this pollen, but the variable region of MHC in case of me did not bind to a pollen. So this is the first step where both of our immune system acted in a different way. So what happens after that? Why is this playing of a pollen by an MHC molecule a big deal? Well, this is a big deal because it presents this pollen particle to the T cells. The T cells then sends a strong signal to B cells to form antibodies against it. Here, you will not understand where these T and B cells have all come in from until you have watched the videos of what B and T cells are and how they react. Well, these are all immune cells. They have their own very important functions in the immune system. And as soon as all these cells get activated, here, as soon as this B cell get activated, it will produce a special type of antibody called IgE, that is immunoglobulin E. Now let me tell you that this IgE is not the very common type of immunoglobulin produced by B cells. It normally produces IgG or IgM kind of antibodies. Now there are videos that talks about all these different type of antibodies. I won't elaborate it here, but these are antibodies produced against a specific type of foreign invader or antigen. Now here, as IgE is produced, this IgE is produced only during allergic reaction. Now what this IgE does and why is it so different? Well, this is because the other immunoglobulins which are produced by B cells through a plasma cell goes and binds to the foreign invader or to the antigen directly. But here, the IgE, it goes and binds to a special type of immune cell called the mast cell. And this mast cell have special receptors on top of it that has very high affinity for IgE antibodies, and IgE goes and binds to these mast cells. Now, these mast cells are said to be sensitized. Now, can you guess why? Well, this is because the mast cell initially had no clue what these pollens were. But now, with the help of specific IgE molecule that has come and docked onto this mast cell has now become very, very sensitive towards this pollen. Okay, let me tell you another thing about this IgE molecule. This immunoglobulin E molecule has a very short half-life, but as soon as it goes and docks onto this mast cell, its lifespan increases. It can now stay potent for around 2 to 3 weeks. And during that time, if this pollen happened to enter the body of Ram again, can you guess what can happen? Well, this time the pollen will be taken up directly by the IgE antibody that's present on top of the mast cells. And as soon as the pollen binds to the IgE molecule, the mast cell ruptures. And as you can see, it releases all its content in the vicinity. Now, before I tell you what happens next, let me clear the board a little bit. Alright, so now as you can see, this mast cell have released some chemicals. So what are these chemicals? Among the many different type of chemical it releases, the very potent and the most important one is the histamine. So what this histamine does is that it widens the blood vessel. So this is the normal diameter of a blood vessel. So as you can see, it widens the blood vessel and then also causes the cells that makes up the blood vessels to shrink. So as those
we have heard about the antihistamine. Yes, so it is as good as bypassing the security guard. We say allow these people like that, sometime it may allow the intruder also.
Cells, which we call endothelial cells, as those cells shrink, the blood vessels becomes permeable and the fluid rushes out of the blood vessels, causing swelling and redness in that area. And that is why Ram gets that redness and swelling in the nasal area. And on top of that, histamine increases the glandular secretion. So let me write down gland secretion. And in this case, it increases the secretion of the mucus glands, and therefore Ram gets a runny nose. And all these causes a lot of irritation in the nasal passage of Ram, and that causes continuous sneezing. Now, along with histamine, some other chemicals are also released by the mast cells, and few of those chemicals also attracts more mast cells to come into that area and burst themselves. And that adds on to the misery that this mast cell was already causing. And that is how my poor brother Ram gets an allergy from pollen. Now let's talk about the remedy and the cure for allergen. Well, sadly, we still don't have a cure for an allergy, but we do have drugs that stops the action of histamine or stops the action of other chemicals that's released by the mast cells.
See, here they are clearly declaring that they don't have any remedy for the allergy. But we have a remedy for allergy mixture number 62, and one more allergy B also. So, and immunity, if we are using along with the allergy, definitely the immunity will become good, and they will only react to what it is required. Like allergy B is a fantastic thing. We have solved many problems of allergy through, if the allergy with the skin, add with a skin D, mixture number 28, I believe. So if it is allergy with a respiratory allergy, use either mixture number 71, or you can say lung balance and allergy balance. There is a one more beautiful this vibration is there, that is allergy balance. Allergy balance and allergy B, that is mixture number 62, like that if you give, and the where is the allergy, give it is many times, it given a very good result. We can, definitely I say you can have the camp for allergy camp. So people have, so many people are allergic nowadays. So definitely with this combination we will be able to give them very good relief. Okay, so we will end here because it was too late today, because because of the Guru Purnima day, we are busy in so many other activities. So I really thank you for giving this valuable time on this auspicious day. Actually, I wanted to meet you on this, want to address to you on this auspicious day, and we'll close for the day, and we'll continue with the next Sunday morning 10 o'clock. We will start 10 or 10:30. I will tell you. We will start with the remedies for the allergy, and if anything else required, we will start that and we will cover on that day. Allergy is a fantastic thing. I mean, allergy is not a fantastic thing. Allergy topic is fantastic thing. So here, antihistamine they give. You cetirizine and all, they give all in antihistamine tablets. Means what they do, they bypass the security guard. They don't say, they say not to react with the allergy. Just bypass it. So you don't get a sneezing. You don't get a problem. But that will attack to you, because you are sensitive to that, it will attack to you. So for that reason, so our remedies are very good for the allergies, and so avoid all allopathic remedies when when it is bypassing your immune system. Your immune system should be trained actually to uh, fight against the different bacteria and viruses and all. And that's what passive immunity we already learned previously, that we should try to make more passive immunity memories so that it will fight naturally. Hmm? So like that, even my brother underwent the uh, bone marrow transplant uh, in the Australia. there after bone marrow transplant, his whole body immunity becomes zero. From there, he was given strict hygienic environment. Strict, no one was allowed to meet him also for at least 3 months. So, like that, slowly, then when that immunity increased, immunity was slowly increased in him. Then, uh, then he given all the vaccination. Vaccination is again giving the all in the smallest quantity. Then he declared fit to face the normal environment. Otherwise, he was forbidden everything. So we have gone underground through these horrible conditions, and we know about this allergy and immune system and very well. So definitely, it's a very good topic for us, and very results are very good regarding this. Okay, then next Sunday morning we will discuss about all the remedies for allergy and immune system. What are the immune system? AIDS is also there. What are the problem? How can we, whether will we give the support to the AIDS? We have seen, AIDS is the acquired
Immunodeficiency syndrome.
immunodeficiency syndrome. So that time we have seen in the long back we are giving that no weight gain happened, and the appetite increased. So many things happened, but we were unable to reverse that the viral loading. Viral loading was also reduced, but the virus presence totally we could not do. I think so. That is tested through antigen. They are using the virus antigen. When the virus antigen is positive, means that effect is will be there. Even though virus is gone, antigen will be there. So in such cases, we will discuss that in next time. Okay. So thank you for giving me this wonderful time, and that on the very auspicious day. Uh, Thank you so much. Okay. We'll let us end today here our class. So we'll class take this thing. Anything you want to know about this, we'll discuss in next this one. You just because you can go once again very soon. I will upload it into the DTF YouTube. So and wherever you feel doubt, because this is a very very important topic. I'm telling you, for drug action, to understand the drug action, to understand the even बोलते हैं ना कि बुरा सोचना भी नहीं चाहिए. What we are using, thought infused water and pills. Even bad thought infused water pills work like a vaccination. What we use, we tuberculinum bovinum, tuberculinum avera. I will tell you next class in that. Tuberculinum bovinum means it's a the glands of the cow, they grow the tubercular bacteria. From that, medicine is made. That is tubercular bovine. So that is used for to cure the, or you can say, the side effect of anytime someone has faced the tuberculosis. Or I already told how to identify this through the Bishwambar Das. Bishwambar Das, many places you can, what you do, you just search for tuberculina. And you will, wherever it goes there and sits, and you see they are telling which chapter. For example, throat chapter. If they are going tonsils, it's going and sitting you are able to find the tuberculinum in the tonsils. Think that yes, that is the miasm of the tonsil is tuberculosis. We say in your few generation, the previous generation, someone might have caught with the tuberculosis. Means your blood, or you can say gene, is attractive to the tubercular bacteria. For that reason, so those things after mutation, or you can say taking different thing, it even shows in a different other symptoms. So like that, there are so many things are there. We will discuss about the immune system and in the next class. Okay, thank you so much. Any doubt we will clear. Please make sure make a point if anything you want to know more. If I know something, I will tell, or I'll understand. I will read and know uh, from so many sources, and I will try to explain to you. So thank you so much.
So,
Ma'am.
yeah, sir, on this occasion of Guru Purnima, I wanted to thank you, Swami Ananda and Mata Narayani, for sharing this wisdom with us, this knowledge of radionics with us.
Yeah, very true, very true. We must, we have celebrated that way only today.
Okay, sir.
Yeah.
Now we are extremely grateful to have a guru like you and
Yes,
also
thank
Swami
you.
Ananda and Mata
Yes,
Narayani.
yes,
Thank you so much.
always we in depth to their knowledge and their contribution to us as a Indian, because otherwise we'll never know about this. This is a UK technology, very costly, but they brought it here and made a Indian version of that. Thank you, Dhananjay ji.
Thank you, sir. Thank you.
Yes.
Good night, sir. Good night.
Okay, good night. Thank you.